Hello, everybody. My name is Christina Cardinale, and this is my um, head-to-toe assessment. Um, this I'm going to walk into the patient's room, and I'm going to show that I washed my hands for good hand hygiene. I'm going to introduce myself. Hi, my name is Christina, and I'm going to be your nurse. I'm going to check the patient's armband and ask her for her name. Your name, ma'am?
Janet Caceres.
And your date of birth.
10/10/76.
I'm going to ask the patient, do you know where you're at?
I'm at hospital.
Okay, so that shows that she's AAO times 4. I'm going to do a set of vitals. Oxygenation, O2 sats, blood pressure, temperature, and heart rate, and respirations. So I'm just going to pretend that I went through the whole thing. I'm going to ask the patient her height and weight. And then I'm going to ask her to get on a scale. So this is her weight. She just got on the scale for me. I just measured her height. Let me go over here, please. I just measured her height. And while she's up, I'm going to just take advantage of the time and ask her to walk for me. Can you, so I could check her gait. Can you walk back on your heels? Okay, she had a steady gait, and I just showed an example of the Romberg. So that shows that, you know, she's intact and musculoskeletal's all right. I'm asking her to bend over, touch her toes. Okay, I'm checking her spine. I'm checking for any curvatures, any scoliosis, lordosis, kyphosis. Okay, you can get that. I'm going to have her sit down on the side of the bed, and I'm going to start the head-to-toe assessment. I'm going to don some gloves. So first I'm going to inspect. So I'm inspecting my patient's face. I'm going to look for symmetry of eyes, nose, mouth. See if there's any drooping or on any side. I'm going to ask her to smile. Puff your cheeks. Lift up your eyebrows. Okay, so it shows that her facial cranial nerves are intact. Okay. After I do that, I'm going to start my head-to-toe assessment. So I'm going to check her head first. I'm going to palpate. I'm going to inspect, and I'm checking for bumps, any infestations, any bruises. Everything's fine. Then I'm going to go down to her eyes. Can you open your eyes, please? I'm going to look at her conjunctiva. I'm going to look at her sclera. They're both pink and white. I'm going to see if there's any drainage. Everything's fine. Any inflammation under the eye. I'm going to go to the ear. And with the ear, I'm going to look for symmetry. I'm going to see if there's any drainage. I'm going to see the tympanic membrane. It should be gray in color, dull and gray in color. I'm going to palpate behind the ear. I'm going to check underneath the mandible, look for lymph nodes. I'm going to check in her mouth. Can you open your mouth, please? Say ah. Uvula is centered. Open up, please. Mucosa's pink. Tongue is pink. Can you stick out your tongue? Can you move it side to side? Okay. I'm going to check her trachea. And can you swallow for me? And her gag reflex is intact. After that, I'm going to put my hands on her shoulders, see if she can shrug up. Okay. And then I'm going to have her lay down. Let me take these. Okay, so now I'm gonna look at her thorax. First, I'm gonna inspect and see if I can see the chest rise and fall. Okay. After I inspect, I'm gonna palpate. Any tenderness? Then I'm gonna percuss. And then I'm gonna auscultate. I'm gonna listen to her back to hear the lung sounds on the posterior side. Can you go ahead and okay. All fields are clear bilaterally. Okay, can you lay down for me, please? I'm also going to check while she's laying down. I'm going to check for her JVD. Can you turn your head? Negative for JVD. Now I'm going to listen to heart sounds. What I'm doing is I'm checking if there's any bruits in the JVDs and the carotid arteries. The apical pulse, you can find the apical pulse. It's midclavicular, fifth, excuse me, midclavicular, fifth intercostal space. So midclavicular, fifth intercostal space. And you're gonna listen for a full minute. Okay, we're going to pretend that we listened to it for a full minute. Then I'm going to check her other pulses. I'm going to check radial bilaterally. Brachial bilaterally. Brachial, just so you can see. Temporal. And carotid. I'm also going to check circulation. Cap refill, less than 3 seconds. You're going to check also for clubbing. Is there any clubbing? Or any deformities of the fingers? I'm going to jump down here to the feet. And I'm going to check for pedal pulses, cap refill, and any deformities or ulcerations, or patient might be diabetic. Check between the toes. Okay. Let me see, what else am I forgetting? The abdomen. So now with the abdomen, I have to get my stethoscope. I'm going to inspect first. And now I'm going to, before I inspect, you do the sequence a little bit different. You're going to see first, then you're going to listen, percuss, and palpate, because you want to listen first because you don't want to move things around when you're percussing. So you're going to do all four quadrants, starting from the right lower and work around clockwise. Then you're going to percuss. Then you're going to palpate. Any pain? Might want to check the patient's face to see if there's any grimace. The last system we have to check is the musculoskeletal. We did some of it at the height and weight. We took advantage of the time we had while the patient was up and, you know, the gait. But now we're going to have the patient see, you know, do it while they're lying down. Can you hold my hands, please? My fingers? Can you squeeze as hard as you can? Okay. Can you push down on my hands? Can you push up? Okay. So she has strength bilaterally in both arms. Now we're going to check her feet. While you're down here on the feet, you can also do the Babinski and see the reflex of the Babinski. So in adults, it should be a negative Babinski. Normally the toes just curl down, but in babies it would fan out, and that's normal in babies. In adults it's not normal. Okay, so can you push? Okay, can you push down on my hands? Okay, so she has strength. Can you rotate your ankles? Okay, so she has strength bilaterally on her both of her legs. Okay, and I think that's it. I think that's the head to toe assessment. Thank you.